Hi, everyone, and welcome to the event. My name is Anna. I'm one of the co-heads of YCW Beijing, and currently stranded in Germany, but hope to be back very soon.
Brilliant. And now Ramon?
Sure, my name is Ramon. I'm a reader in international relations at King's College in London, and I also hold the Korea chair at Free University of Brussels.
Fantastic. And Kaho?
Hello everyone, my name is Kaho Yu, and I am a senior analyst with Verisk Maplecroft, and I focus on the political economy in East Asia.
And last but not least, Bo-Jiun.
Hello everyone, Bo-Jiun here in London. I'm a Taiwanese, and I am a PhD candidate under Ramon's supervision. I study international political economy, and I focus on Taiwan-Southeast Asia relations, and also Taiwan's domestic politics. And thank you for having me.
No worries, it's our pleasure, and themes no doubt that we'll delve into greater detail over the next hour. Thanks everyone. Anna, so without any further ado, I'm going to pass over to you now.
Okay, thank you, Michael. So maybe to get us started, in the past couple of months, many discussions have centered on how best to control the spread of the COVID-19 pandemic. And while the pandemic was and is raging in some countries, others, notably in East Asia, have relatively low case numbers and very coordinated responses to the new outbreaks that we've been seeing. Your report titled "Preventing the Next Pandemic: Lessons from East Asia" aims at explaining why these countries and territories have done such a good job in fighting the pandemic. So to get us started, what are the four Asian tigers, and why does their experience of handling COVID-19 stand out as a case study?
I can take that one. So basically, the four Asian tigers are Taiwan, Hong Kong, Singapore, and Korea, the countries that developed from the 1960s, 1970s onwards, and today have become fully developed countries. So the countries that came after Japan, I guess, in terms of development in the East Asia region. And the reason why in the report we focus on those four countries, we also include Japan and China, but we decided to focus on these countries for two reasons, really. One of them, the institutional capacity, which is what the report is focusing on, because there were some explanations 2-3 months ago, and also when the pandemic started, about why these countries are dealing well with the pandemic compared to Western Europe, compared to Latin America, compared to the US. Some people were talking about the culture. Some people saying, well, citizens in these countries might be obedient. They were talking about Confucianism, and I think those explanations don't really hold. So I wanted to focus on something that seems to hold better, and we will discuss today, which is institutional capacity, but also because this is something, and I guess goes back to the subtitle of the report, which is lessons from East Asia, this is something that is replicable in other parts of the world, because we are talking about the institutions in these countries, how have they been built over years, and how they have been deployed and used during the COVID-19 pandemic. So in theory, this is something that countries in other parts of the world would be able to replicate, not only when a second wave of COVID-19 comes along, but also in the future with another pandemics or outbreaks.
Thank you. And Kaho and Bo-Jiun, as far as I know, you've been following the Hong Kong and Taiwan policies combating COVID-19 respectively. So what are the key takeaways from Hong Kong and Taiwan? And in your opinion, are there any actions taken by Hong Kong and Taiwan governments that were especially effective, or anything that these two especially did not do as well as the others?
Maybe I will go first. So for Hong Kong, we know that it is kind of famous for being hit by the SARS over a decade ago. So that was kind of very important experience and memory, not just for the society, but also for the government. So at some point, although every country will have some sort of crisis management, but for Hong Kong, they do have a very mature framework to look at almost all the details in how to manage pandemic. But of course, when some crisis like pandemic is hitting the world, so every society, everyone will just be complaining about this. But if we try to look at the institutional infrastructure of Hong Kong in looking at the pandemic, then actually it is covering a lot of the aspect of it. And more importantly, they do have a lot of ready for use mechanism in order to tackle the problem of a pandemic. So when the pandemic hits and once the government identify, oh, this is something important, this is a crisis, then immediately they will just automatically trigger some sort of mechanism. Let's say some medical arrangement for the with the hospital, or some resource allocation, or any other coordination beyond Hong Kong. And I think these are the key lessons that we can learn in the COVID-19 from Hong Kong.
Mm-hmm. Bo-Jiun, do you want to add anything on Taiwan?
Sure. Yeah. So along with what Ramon and Kaho just said, I think Taiwan's case stands out for an obvious reason. Actually, it could have been hit hardest by the pandemic, as the island is just only 130 kilometers or 81 miles off the coast of the mainland China, the origin of the pandemic. But yet the number of confirmed cases has been only 451 as of today. And among which there are only 55 local transmission cases, which is quite impressive, and the death toll is 7. Also, there has been no lockdown imposed since the beginning of this year. Well, you use pretty similar case with South Korea, but Singapore, you have the CB, but it's soft lockdown, and it didn't last very long. But of course, in the case of Taiwan, success doesn't happen overnight. Several early measures taken by the government has been proved quite effective, and this is all based on the institutional capacity that I highlighted in our report. To name a few, the authority intensified airport quarantine inspection starting on December 31st. And activated the Central Epidemic Command Center, CECC, on January 20th to coordinate policies and utilize Taiwan's expertise in information and communication technology, ICT, to enforce contact tracing and mask rationing. So these measures of the so-called Taiwanese model has been praised globally and referenced by several countries, including New Zealand, led by Prime Minister Jacinda Ardern. And so I think it's fair to say that the Taiwanese model has been working well, and all the hard work the government and the civil society had done over the past 6 months really paid off. And similar case applies to South Korea, Hong Kong, and well, for Singapore is before April, it was quite successful, but until the outbreak in the migrant workers dormitory.
Yeah.
So that's a case for Taiwan. Yeah.
Maybe we can touch upon the Singapore case again in a little bit, but first I wanted to broaden our scope a little bit to the rest of the world. So states routinely share information through WHO and through other channels. And in the early stages of the pandemic, when it was spreading in China and in some Asian countries, there was a lot of criticism directed at Europe and the US, for example, or other countries as well, for not taking appropriate measures to prevent the pandemic from spreading there. And now we do see that in many countries in the world that they're not doing as well as the 4 Asian tigers, not at all. So you mentioned this earlier when you were speaking, Ramon, that these lessons should be replicable by other countries. But this is not really what we've seen so far. So do you think that a firsthand experience of a pandemic like SARS, H1N1, or MERS is necessary for states to learn how to apply these effective public health strategies? Or why were the lessons from previous pandemics that exist in these 4 Asian tiger states or territories not learned by other states?
Not necessarily in the sense that there have been previous pandemics, for example, emerging in North America, right? Mexico and the US, 2015, they had another pandemic that then spread to other parts of the world, actually. And you see how the US seems not to have learned the lessons from back then. What we see with the 4 countries that we're covering, right, the 4 Asian tigers, is yes, they went through their own pandemics, and obviously this helped because they have the experience from dealing with this in their own countries. but also they have been learning from other pandemics in other parts of the world. So when a pandemic or even an outbreak, because not all outbreaks lead to pandemic, takes place, then the WHO collects information, and this is shared among all members. And members can access information. They can actually send teams to the countries where the pandemic or outbreak has taken place as well, and they can gather more data if they want. And this is something that I think maybe because we haven't had SARS or some of the other pandemics here in Europe, in the US as well, we were not as ready. But then if you look at countries such as New Zealand or Australia, especially New Zealand has been doing quite well. They actually learned from pandemics in other parts of the world because New Zealand didn't suffer any of these pandemics. Maybe you could argue they were in the Asia Pacific region, so they knew what was going on in East Asia. But again, I think it's not about the case about going through it, but actually paying attention to what's happening in other parts of the world as well. What I do think though is that this has been a wake-up call clearly in Europe, in the US. So we should be learning more, and actually there is already evidence that if you look at countries such as Germany, for example, it has already learned throughout this pandemic in terms of contact tracing, and something that other European countries, Belgium, the UK, for example, haven't done. If you look at Central Eastern European countries that haven't gone through a pandemic, they have fared quite well compared to Western Europe. If you look at the number of cases, the number of deaths, healthcare system not being overwhelmed. So they actually learned during the pandemic itself, not necessarily from previous cases. So I don't think you need a pandemic. In short, you can learn from other places and you know, get the right lessons and apply them.
Maybe one last question from my side. Speaking of learning during the pandemic, we touched upon this a little bit during the first question, the case of Singapore. So that took a turn, I think, in April or May. So is there anything that you can say about that? Did they just have to adapt their strategy? Is it still consistent with what they were doing before? Or can we see a big change also in the kind of policy and measures that were used in Singapore?
Kaho can add to this, but there are two issues with the case of Singapore. A, they did adapt during the pandemic itself. They haven't been the only country adapting through the pandemic. If you look at the case of Korea, they adapted from the first few weeks when it wasn't doing very well, the country, and then later on they had to change course. But what hasn't changed in the case of Singapore is the focus on tracing, the focus on avoiding infections within the hospital system, because this has been a very big problem in many European countries. There have been many infections within the hospital system, within residences for old people, for example, as well. And those are very dangerous, right? Because these are people who are already sick or who are old, so they can suffer. And that's something that Singapore, for example, hasn't changed. So the isolation facilities that Singapore has, they are not located necessarily in hospitals, they are independent. And that's something that came from the beginning. And this was a lesson that was learned from previous pandemics, right? And in some other cases, yes, there has been some adaptation. So for example, the lockdown, it's true, it was a soft lockdown compared to what we have seen in other parts of the world. But that was something that was introduced midway through the pandemic. But Kaho, I think you have lived through it, so you might know a bit more about it.
Yeah, I am based in Singapore in the last 2 years, of course during the pandemic period as well. And I think the policy here is quite consistent, and it is a little bit similar to the case in Hong Kong. So actually both sides are learning from each other. And for Singapore, I think of course, it has a very strong institutional capacity, and the question here is more about what is the right timing to roll out all those kind of containment protocol or things like that. Because for a lot of countries, especially for the Asian four tigers, they also always have to take into the economic impact into consideration. So this will somehow have an impact on the decision making, because they already have a full set of mechanism, what to do in this stage, what to do in the next stage. So the decision is more about the timing of all those policies. So for Singapore, we do see that they have a very thorough thinking of how to roll out all this stage by stage, step by step. So you can see that it is quite well organized. In the stage 1, they are talking about maybe this level of containment, and then the next stage here. And when they try to ease it, it is also again stage by stage. So I think this is something that policymaker may wants to learn from this model as well.
Mm-hmm. Yeah, I mean, you touched on this again a little bit earlier, Ramon, that your report focused on the institutional capacity of states or territories to respond to the pandemic. But what I'm wondering is how important, or does your study say that this is the most important thing when responding to a pandemic? Because how important are these institutional capacities as compared to other factors that can determine the success of combating this pandemic? You touched upon it a little bit earlier: culture, social values. What about social media communication, or kind of a travel hub status if there's a lot of traveling in and out? I don't know, how can we weigh this, the results of your report?
I think indirectly we do point out that human resources are essential. So we have the institutions, yes, they do matter, but for example, the human resources in the institutions, I would argue, are even more important. So what we see, for example, with the Centers for Diseases in these countries, they tend to have a stable personnel. They tend to be non-politicized. So even if there is a change in government, and we have seen in South Korea, for example, from conservative to liberal in recent years, the institution itself, the personnel is not going to be changed for the sake of politics. So that's quite important. And for example, in the case of the US, when the Obama administration ended this term in office, they had prepared a playbook to deal with pandemics. And then the Trump administration came to office, and they tore the playbook aside, and they haven't been using it during the current pandemic. So you see the importance of human resources and the non-politicization of these institutions. And also one point we make, for example, about tracing is that you can have the best technology in the world, but you need the people who are going to use the information, the data that is being gathered, for example, to contact those that might be infected. This is quite important as well. It's not enough to have the technology, the app that will allow you to say, well, these two people were in contact with each other, right? You will need the person who is making the phone call or knocking on the door and saying, look, you have been in touch with this other person, therefore we want to test you, for example. And one of the cases we have in the report, we're not discussing it in detail today, is Japan. Japan didn't use an app, for example. What they did, they actually have many people who were well-trained over the years, but some other people also who were trained when the pandemic started in tracing basically those who might have been in contact with someone who had tested positive as a case of COVID-19. So I think that matters. I don't believe in culture myself. I don't think that culture is important. But for example, something that we have seen over the last few months, there have been these surveys about mask wearing. And it is true that, for example, in Asian countries, wearing a mask was more common as soon as the COVID-19 pandemic started than it is in Europe. Now in Europe, this is changing. I don't know if that's culture or not, or it's simply experience of having gone through pandemics before and knowing that this actually helps. So yes, there are some other explanations, but personally, I don't think they're as important as the institutional capacity and the human resources that are attached to institutions.
Mm-hmm. Yeah. Maybe one final question before I open it up for everyone else to pitch in their excellent question. Maybe just for those who've only skimmed the report, what are the policy recommendations that you came up with? And can you point out which ones of those you think are more important than others, or are they all equally important and all of them need to be implemented to combat the next pandemic?
Yeah, actually, in the report, from pages 16 to 19, I'll just briefly point it out here. These are tables. I think through these tables, you can compare all the, the policies, all these Asian tigers plus Japan, and of course China, they have done on the in terms of legal structure and the use of technology and the healthcare structure. So what are the current existing policies and also the new policies that being adopted during the pandemic? And just look at the table and you see if, for example, for the use of technology, I think most countries have built up the apps for contact tracing, and it was being proved quite effective for home quarantine requirement, and also to track all the confirmed cases, the imported confirmed cases during the second wave of the pandemic. So I personally think that because it's a group project, but I will highlight the use of technology is definitely more the most important factor, and it could be easily replicated in other countries. Easier. I mean, well, it takes institutional capacity, resources, staffing, as Ramon just mentioned. You need kind of experts in the field who has practiced these. For example, in the case of Taiwan, the airport quarantine inspection they have done that for 17 years, since 2003. Not like it doesn't happen overnight, right? It's not like, oh, December 31st, let's do it. And we have staffing, we have equipment to conduct the whole, to do the standard operation procedure, SOP, as I think Kaho has also mentioned about the Singaporean case. So it takes experience and takes some suffering through experience through the previous pandemics to come up with all this mechanism. But so for other countries, whether or not they have come through this kind of pandemic before, I mean, these are the existing structure or the examples that other countries can refer to and can replicate. So, but I would just highlight that I think the technology part is easier to be replicated. Thank you.
It's quite a hopeful message, I think, because as you said, if the technology aspect is so easily replicated, then we should be asking what is keeping countries from doing it, or it should be an encouragement to countries to do this relatively small and low cost measure and thereby hopefully achieve a great effect. Okay, I think this is it for now for questions from me. Thank you very much for all of your answers, and I'd like to open it up now to the audience. As Michael said before, if you just type your questions into the chat box, then I will read them out to the speakers, and then you'll get your answers momentarily. Maybe while people are still pondering what to ask you, because probably they have way too many questions going around in their heads. Is there anything that you saw in the countries countries and territories that you analyzed that they didn't do very well? Were there any mistakes in the beginning? Were there any kind of misjudgments of the pandemic that were then corrected after a while?
I think, yeah. I mean, I think you could point out that the response was very quick, right? But when it came to airport controls, some of them were better and quicker than others, right? So Taiwan, I think, is a good example of how to implement this. If you look at the case of Korea and Japan, for example, they were not as quick, especially Korea, and as good, right? So this meant that, for example, when the pandemic became big in the case of Korea, it was from some South Koreans who had actually went to China, and they brought COVID-19 with them, right? And I think that's something that might have to change in the future, that responses at the airport level, so way more controls or stopping flights even to certain countries might be done more quickly. Having said that, there was also a debate because obviously there is an economic cost to this, right? You implement these controls and there is an economic cost, and who knows, maybe the pandemic is not as big as this one has been. But I would say that's one of the things that that probably could have been done better, actually.
Mm-hmm. I mean, there is a question about that actually coming up from Aiki, wondering how the 4 countries and territories balance between containing the spread of COVID-19 versus the economic impact of lockdowns or circuit breakers. Is there anything, did you find anything in the institutional, policies and its institutional setup in combating the pandemic?
I can take on Korea and then we can go over the other 3. In the case of Korea, the reason for not having a lockdown, one of the main reasons for not having the lockdown was the economic cost, right? If you have a lockdown, then as we are seeing in many European countries, you're going to have a huge recession, a huge increase in unemployment. And that's something that I find quite interesting, that if you look at the unemployment rates in the countries that we cover, it hasn't gone up to the dramatic levels that we're starting to see in some European countries, 10, 15%. And I think that was a very calculated decision. Let's use the technology, let's implement other measures, let's do track and tracing as soon as possible, because otherwise we're going to have to close down the economy. And in the case of Korea, the government clearly wasn't ready to do so.
Kaho and Bo-Jiun, do you want to add anything from the perspectives of Hong Kong or Taiwan?
I think for Hong Kong and Singapore, the biggest question for the government is how to balance between the containment protocol and the economic impact. So actually it is a balancing act between them, or it is a dilemma, but actually it is a problem of everyone, because the pandemic like this one is very different from what we've seen from SARS. SARS, although we call it a global thing, but actually it is still very regionalized. But the COVID-19, it is a really globalized pandemic, which means that it results in a lot of disruption in the supply chain. And especially for Hong Kong and for Singapore, the issue is that a lot of the global logistics are being interrupted. So there are a lot of delays. And this means that somehow the supply chain is broken from the production part, the upstream, to the midstream, the logistic, and the downstream, which is the buyers. And for this, for a lot of countries, they have or territories, they have rolled out different kinds of financial stimulus to ease the impact on slowing down global economy. And then the question for I think Singapore and Hong Kong are maybe at a little bit better position, because their economic capacity is a lot higher than a lot of other sovereign countries. But still the question is more about if all those financial stimulus or support are sufficient or not. And for territories or government like this, what they have to take into consideration is not just to rolling out the framework of something, but they have to really target the recipients, which especially the small and medium scale enterprises, because kind of I do believe bigger companies may survive because they have more a thicker layer of reserve, but for the smaller ones, if they are down, then they are very likely to be bankrupted. And for governments like Singapore and Hong Kong, I think when they plan the COVID-19 containment protocol, of course, in first, oh my God, it is happening. Then what is going to happen next to the economy? If everything is done, then we are done. Then so for them, they do roll out a series of packages to help a lot of smaller companies. But of course, again, whenever all this happens, there will be a lot of complaints. So there must be some pros and cons of this. But we do see that government like Hong Kong and Singapore, they are trying to cover as much as they can, and they are rolling out things step by step. If you try to roll out the containment protocol step by step, then this can actually slow down the impact on the economy, because this provides time for the society and for the companies to adapt to it. For a lot of companies, actually they don't have the internal protocol to how to tackle pandemic. So for them, it is the learning curve can be quite long. So they need time to adjust to it. And more importantly, let's say a lot of government, they are very it is very tempting for a lot of people to ease the containment protocol because they want to chase back the economy or the production as much as they can and as soon as they can. And this is actually creating the risk of having a second wave of outbreak because people just get back to factories, get back to the labor-intensive working site and things like that. So for especially for Singapore, when they ease the restriction, they ease it step by step and stage by stage. So people can slowly, gradually get back to the normal business life, and this is somehow also, I believe, it is also buffering a second wave of outbreak. But of course, I don't think there is any perfect case. There will be a lot of loopholes in all this, and we will see a lot of new cases and of course complaints. But from a perspective of the policy, I do think both government is trying to balance between the restriction and the economic recovery.
Mm-hmm. Bo-Jiun, did you want to add something from the perspective of Taiwan? Or
just a quick point, because there's no lockdown in Taiwan, but I think the main reason why the government or the public have so far they took it seriously. They took the pandemic seriously, the threat seriously, and they acted quickly, swiftly. It's because they didn't want to have a lockdown. So people probably saw this coming, right? If you don't, given the geographic proximity across the strait, it's so easy that if you don't do anything from the beginning, if you don't get nervous about it and be aware of this, and the consequences will be very bad for Taiwan. And like Johns Hopkins, they estimated Taiwan could be the second hardest hit country in the pandemic. And of course, the following result would be a total lockdown. That's what you are seeing in many countries in the world right now. And so the daily life is still going as usual, pretty much. And we still have baseball games to watch, and you can even attend it and be in the stands and chant for your team. And so that's why make many people around the world, sports fans, probably jealous about it, and they are criticizing their government. Why you're not incapable of doing all these measures, and why we didn't react like Taiwan did, and or why you just don't put on masks. So this kind of thing is a discussion. But for the economic impact, I think government right now is they try to come up with the stimulus vouchers, provide the citizens to encourage people to spend and to buy domestic products. And so that's why actually the Taiwan economy has done pretty well. In this year, it probably is rare to see a positive GDP growth for countries across the globe, but Taiwan is still, I think, it still keeps its GDP growth in a positive figure. Yeah, so I think that's why all your hard work actually pays off.
So I have two questions here, which are how do we get the people to do the hard work? So how can governments increase the acceptance of protection measures by the people? How can governments help them understand that this is for their own good and not, kind of shift the conversation away from taking away rights or freedoms to this is actually what we need to do in order to prevent something even worse from happening? And then there's another question that is kind of asking how you think surveillance factored into that. So if a society is being surveilled by their government, were they more likely to adapt certain measures or to wear masks or stick to certain rules than others?
I think on the first question, I mean, there's the issue of leadership, right? So there are a couple of things here. If we look simple as mask wearing, right? Many leaders, political leaders in Western countries they didn't want to be seen wearing a mask, right? So this meant that people were not as willing to do so. But then what you saw in East Asian countries from the beginning, this was happening. But interestingly, in the case of Europe, Central Eastern Europe, from the beginning, you have political leaders who are actually wearing a mask, saying, well, this is acceptable. This is the way to deal with it, right? So again, this is not about East versus West. This is about how leaders take decisions by example, which takes me to the point about surveillance or using apps that are actually beneficial for the population. There are two aspects to this. One of these, and we talk about in the report, is the legal framework, right? So countries across East Asia, they have legal frameworks that can be activated in case of emergency, not only a pandemic, it could be any other emergency. And this means that governments have certain powers that they wouldn't have in normal times, for example, to increase surveillance. Now, these powers then, once the emergency is over, they should go away. And again, at the very least in the case of Korea, this is what was going to happen. So this brings confidence that this is not a permanent measure, and this is not a surveillance mechanism that is going to be introduced as a result of an emergency, a pandemic in this case, and it's going to stay with us forever, right? And I think people understand this. And the other component to this is to explain. And again, going back to this point, if you look at apps, the case of Germany that had no app before the pandemic, and now I think has been downloaded something like 10 million times, right? So this is something that the government was able to explain. This is going to be good for you. Among other things, you are not going to be in lockdown, right? Because we talk about surveillance, but the other side of the coin, right, is actually that without the surveillance in these East Asian countries, you might have had a lockdown, people staying at home and not being able to have freedom of movement, something as simple as that. So you would have the trade-off, and you could argue this is even worse, right? So if governments explain, well, if you use this app, this is going to allow you to carry on with a more or less normal life. It's not going to be normal, but at least you're going to be able to move around. You are not going to lose your job because your company is not going to close because the economy is not doing as bad as it would be doing otherwise. I think it's not difficult to explain this to people. And I think something that we have done actually in Europe as well, but maybe it took us a bit longer, is that there were experts explaining this. So not necessarily only the political leaders or the president or prime minister of the country coming out and explaining, but you would have, for example, the directors of the Centers for Diseases explaining the decisions, right? And this cuts across all societies. Experts, people trust more in experts than they actually trust politicians, right? So having these people providing the explanation seem to have brought confidence in the measures that were being introduced, as opposed to having the president or the prime minister that many people will oppose for ideological reasons, for example. So that helped as well.
There is another question around countries that have perhaps lower state capacity. So someone's asking about developing countries such as India. What do you think that they can learn from the 4 Asian tigers in order to kind of help flatten curves that are now, going up again?
Well, I mean, one thing that to be said is that this technology is not very expensive. So if you look at Vietnam, which is another developing country, they developed their own tracing technology domestically, and they also developed their own tests domestically. And these are very cheap because Vietnam needs them for its own population. So some of the lessons that we have, for example, developing the apps and making sure that they can be downloaded and used, and developing the tests at the beginning of the pandemic, so you know who's been infected, has been done successfully by other developing countries, plus the legal framework. So the legal framework itself can be adapted, and actually is being adapted by other countries in Southeast Asia. The legal frameworks that you see in more developed countries in East Asia, right, are being adapted by developing countries in Southeast Asia. So at least they governments know and citizens know what powers are to be used by governments in case there is a pandemic. So there are lessons that can be implemented. And one thing that we mentioned in the report as well is that there is consultation between ministers of health, between disease agencies, so agencies that deal with epidemics. There is consultation across the whole of East Asia, the so-called ASEAN +3 countries, but also within the WHO framework. And of course, this doesn't necessarily apply to Taiwan for political reasons, as we all know, but Taiwan, for example, consults with other agencies in Hong Kong, in Korea, and Japan. So this can actually be done because you learn from the experts in other countries how to deal with a pandemic. And this is actually being actively done at the ASEAN +3 level. So I wouldn't be surprised if there is consultation going on with India at this stage, or at least is going to be beefed up. So there are things that can be done without having a strong institutions and without being a rich country.
So I'm gonna maybe ask one more question about how countries handle, or how countries and territories handle this internally. So there's one question about schools. So apparently in Canada, there is a debate about how to reopen schools. We have the same debate in Germany, I assume in the UK as well. And how do these countries how have they been handling this?
Shall I start with Korea and then we move to Taiwan, Hong Kong, and
Sounds good.
Singapore? So yeah, so in the case of Korea, schools were closed for a while. Now they have started to reopen. So at the peak of the pandemic, they were closed, and now they have started to reopen. If there is a case in a school, so a kid goes to school and he or she is infected, right, with a case of COVID-19, the school itself will close down for a number of days, but not the other schools in the district, never mind at the country level, right? So this goes back to the use of technology, right? If you can trace a cluster, in this case in a school, you can trace those who have been in touch with people who might be infected, right? Because they're connected to the school somehow. You can actually close down the cluster itself, and you don't have to close down the whole school system. And my impression is that that's something similar to what we're going to do in Europe, because I mean, closing a school for a whole academic year is detrimental to kids, right? To kids going to school is really not feasible. And the second aspect to this is exams. So exams are going to be postponed for the year, right? So that no student is disadvantaged. Because one of the things about schools obviously is that if you close the school, those kids that are poorer, right, whose families are poorer, obviously are disadvantaged. So you don't want to disadvantage these kids against other kids who maybe don't need the classroom setting as much because they can study in some other way. So this is why exams are being postponed, which is not so different to what you see in the UK, for example. We're talking about the same with A levels not taking place, or you can retake them next year, for example. So things like that. So that's for Korea.
I think closing school is quite a complicated policy or a decision in both Singapore and Hong Kong, because there will be a lot of pushback from the society. On some people will think that, oh, it's okay. Some people just think that, no, it is not. So it is relatively easier nowadays to shut down the schools because of the technology. Let's say, for example, for universities, when they shut it down, they can just put everything online. So a lot of students are actually used to it. And even for examination arrangement, it won't be that difficult. But the problem actually is comes with the primary school or secondary school. Because if you close the school, and this means that you will have your kid 24 hours a day, 7 days a week at home. So for a lot of parents, this is maybe another problem. And it is unlikely that you can just do the online course for the kids. You can just do a, let's say, a music course, piano course, something like that for the kids online. It is just not feasible. So a lot of I think for the school arrangement, because it really touch on something beyond the pandemic itself. I mean, it covers a lot of the social issues in different territories, and eventually it complicates a lot of the policy making process. And for example, let's say in Hong Kong, we do see that there are forward and backward policy making on this, because in the first place, yes, they close the school. Then the pandemic is down, and then maybe it's time to bring the kids back to school. But in this week, there is a kind of a second wave, then they have to close the school again. So what I mean is that you can't really avoid all this, prevent all this. There's no perfect case, but still this create a lot of problems for the government.
Yeah. Well, in Taiwan, schools haven't been closed. So I guess students are not familiar with all the trendy apps like Zoom or Teams. They don't. There's no. I mean, they don't have to use it actually. There's no need for online education because schools, the lives are still going on. I don't know whether students are happy or not, but the winter break was extended for 2 weeks in Taiwan. That's when the first wave of the pandemic hit Taiwan, and then it was quite a risky time, and the Ministry of Education decided to extend the winter break. That's the break between the spring semester and fall semester and spring semester. Yeah, so that about the time of the Lunar Chinese New Year as well. But 2 weeks, that's it. 2 weeks extension, and for the break. But now schools have been open since then, and now we're entering the summer break. So I guess, but they remain open, but still the policy is that encourage hand washing to keep your high standard for personal hygiene, and encourage social distancing. So those are the policies.
I have two more blocks of questions here. So one is, again, about other factors than institutional capacity. So there's one person asking whether you think, or to what extent you think social cohesion played a role in the 4 Asian tigers' relative success in containing the pandemic. And then there is another person asking whether what slowed down leadership and compliance almost everywhere, but in the 4 Asian tigers in Japan and China, was the othering of the disease as a Far Eastern or Oriental epidemic, and that, I mean, we had these obvious instances of racism, and also in the other pandemics that you analyze, I think apart from H1N1, but SARS and MERS were prevalent in the region and not very prevalent in other regions, let's say it like that. Or there's this kind of regional aspect to it. And yes, the racism aspect. So I don't know if you want to comment on that.
I mean, on the second one, I do agree that there was an element of racism, if you want to put it, of saying, well, this is happening over there, it has happened in the past. Not only with Asia, I mean, there have been epidemics in Africa, for example, right? Ebola, for example, is still raging in parts of the continent, and we don't pay attention to it because it hasn't reached Europe or North America, for example. Having said that, you cannot say every single Western country acted in the same way. Australia and New Zealand from the beginning said, well, this can reach us, or this will reach us actually, we think this will reach us, and as it did, but they were acting from the beginning on containing this. And I mean, I keep referring to Central Eastern Europe because it's another example of a region that has no experience of pandemics, but from the beginning said, this can reach us, and it's probably going to, right? And I think that's part of the reason, but having said that, we shouldn't forget that the pandemic reached Italy very soon. And even in the case of Italy, there was this perception, oh, well, that's Italy because they have links with China, but this is not going to reach, let's say, the Nordics, for example, or it's not going to reach the UK. So even within Europe, there was this differentiation between countries and this idea, well, some countries are less prepared, but in our case, we're better prepared. But I mean, I do take that point, and yeah, we don't deal with that in the report because the report is really more about a different aspect of how to deal with the pandemic. But it is true that there was an element of that. And on the social question, it's very interesting because there was this report over the weekend about asking people across the world why do they wear masks, right? So it was a question related to the pandemic. And what you see is that both in the Asian countries covered, I remember if it was, I think it was Korea, China, and Japan, but there were also Western countries covered, the US, Germany was there, Spain was there, right? The reasons that people gave for wearing masks now, not at the beginning of the pandemic, was fairly similar. They said, because, well, this is a way of taking care of others, not necessarily myself. So it seems that this social cohesion message has spread to Western countries now, at least when you ask people, why have you decided to wear a mask? And there has been this dramatic change in Europe. They say, well, I'm not protecting myself, I'm protecting society, so to speak. So it might be that this has been a turning point in this respect when it comes to future outbreaks, not even pandemics, right? People saying, well, I have to take care about others, even if it's only my family, by wearing a mask.
So one final kind of double question before I hand back to Michael. So someone was asking whether, kind of looking back towards the start of the pandemic, whether the success of the 4 Asian tigers and the other countries that you were looking at gave a false sense of security to the rest of the world in how dangerous this pandemic would be, whether you kind of feel that that is an accurate statement. And then the other question was looking forward. Do you think that the 4 Asian tigers, and you've also mentioned Vietnam, New Zealand, will, because of their excellent or very well handling of this, of their response to the pandemic, will have a bigger or maybe slightly different role in international relations? I think you're muted still.
Oh, sorry. Now, I was saying that I think so, and then my colleagues can chip in. On the second question, yes, I think so, in the sense that what we are seeing is a reevaluation, right, about how do we deal with this type of things. It didn't start now. I mean, some people are talking about the moment between the global financial crisis 2008 to 2020, a 12-year period in which some Western countries realized, well, maybe economically, but also in terms of healthcare, we are not as advanced compared to other parts of the world as we thought we were. And I think all these talks, for example, about, in different contexts, but about a G10 or a D10, in which we include countries such as Australia, Korea there, or India, is part of this reevaluation that we have to look at other parts of the world. And on the first question, yes, I mean, I do agree. I think the fact that, you saw Taiwan, Hong Kong, Singapore, and Korea dealing fairly effectively with the pandemic from the onset, especially Korea, because Korea obviously suffered from, we had the second largest number of cases after China in the beginning, and other countries saying, well, it seems that this can be dealt with in not very difficult way, right? Taiwan, I think, Bo-Jiun mentioned, seven deaths, for example, right? So it's not going to be as bad as we think it would be. Same with Japan, by the way, and actually that wasn't the case.
Kaho and Bo-Jiun, do you want to add in on one of these questions?
I think the case for Hong Kong is quite special here because if you look at the cohesion or things like that, actually, I think it is because Hong Kong was kind of the memory of the SARS are still iron in everyone's head. So actually, right, even before the pandemic started, I think a lot of people are alerted to all those mask wearing or things like that. So it somehow make it easier for them to adapt to what the government is trying to do. Let's say the containment protocol and things like that. It is a lot easier for the society to get used to it or be in line with it. So this means that maybe for another government, it may take 4 weeks to educate them to do this. But in Hong Kong, they will just automatically follow all this. So it creates less burden, a little bit less burden for the government. But I believe after the COVID-19, because this is again a nightmare for the world, then a lot of all these countries will have this memory already. So when for the next pandemic, but of course, touch wood, we don't want to have it. But if there is, then a lot of the societies will very likely to be more used to all this containment protocol.
Yeah. So following what Ramon and Kaho just said, I agree about the memory. It's a collective memory, collectivism of the like memory of SARS, H1N1 maybe not so much, but SARS, definitely people in Taiwan they remember that because they suffered that. And I was in high school, we were all putting on masks on the public transportation, and our parents were so worried about their kids, and so in the civil society, in the public populations are very hyper vigilant. It makes it easier for the government to give guidelines and to give guidance and to work with the public. And so it's a two-way street. And so the public actually cooperates with, I think across East Asia, usually, the public, the people are willing to cooperate with the government because it's extraordinary times. So it needs extraordinary measures. So people have that perception. So easier for everyone to step into the plate and to work together. And that's why in Taiwan you see that there over more than 90 days without there's no community cases, no local transmissions for more than 90 days, almost 100 days. Knock on wood. Hopefully that will the momentum will continue. So it takes everyone, not just people have been praising the government. Government has done a really good job, but without the cohesive, the social cohesion as a foundation, then it will be very difficult for all the policies, all the maybe in some Western countries' eyes, there are draconian, very strict measures, but in East Asia, in East Asian context, those are people are already familiar with those measures. But of course, if it's quite intrusive into privacy, some civil groups will raise those concerns, and there will be a debate. Of course, so I'm not saying that people are very just obedient to whatever the government says, but they would challenge it. But whatever makes sense, they would do that, and to combat the pandemic like this one.
Great, thank you very much to the three of you. I think this was really great and really, really informative, and gave everyone a perspective. What you talked about in your report, but also, further than the report, outside of the report, what can we learn from the 4 Asian tigers? Thank you everyone for your excellent questions. They were really, really good. I didn't get to read out exactly all of them, but I think we touched upon all of the things that were raised in the questions. And with that, I give the word back to Michael.
Thanks, Anna. And let me also just echo thanks as well to Bo-Jiun, Ramon, and Kaho for sculpting a conversation that's been wide-ranging. I mean, it's touched not just public health policy, but also social policy, education policy, technology strategy. And for that, thank you very much. I mean, one of the great takeaways I take away from this conversation is the universality of the challenges that we face, whether we're in Singapore, Hong Kong, or over here in the UK or in Germany. Whether you're a parent trying to juggle working from home and schooling your kids, or whether you're a society that's trying to get familiar with wearing your mask, the problems are universal in a way. And with that in mind, so might be the solutions if we are open to learning from others. Okay, so that marks the end of the conversation today. Thank you all for tuning in. Before I return you all to the rest of your afternoons or your evenings, I'd just like to make one quick announcement on behalf of the London chapter here at YCW, which is in relation to our next event, which is a book club on the book Mr. China. It's written by Tim Clissold, who was one of the first people trying to mobilize Western capital to fuel foreign direct investment in China. And his book tells the story of his experience of losing $490 million in a series of ventures that that suffered challenges for all sorts of reasons. It promises to be a really interesting book club, touching on a personal story, but also an extraordinary one too. I don't think any of us in our lifetimes can imagine losing such a huge and colossal sum of money. So I would really, really hope that all of you can join us once again to partake in discussing the book with the author himself, who will also be dialing in too. That event takes place on the 27th of July, also a Monday, taking place on 6 p.m. British summertime. So please do keep an eye out for that. But in the meantime, let me just say thanks again, everyone, for tuning in. Thanks to our speakers. Thank you to Anna. And I hope to see you all again very, very soon. All the best.